My name is Christine Kirkpatrick. I'm from the San Diego Supercomputer Center, where I'm Division Director of Research Data Services and where we host the GoFair US office. I'm delighted to have Professor Dr. Mirjam van Reisen here with me today to talk about VODAN-Africa and their efforts for the training of trainers. I don't know if it's okay to call it talk, but you have to tell us how to pronounce the acronym. She is Professor of Computing for Society at Leiden University and Professor of International Relations, Innovation and Care at Tilburg University. She leads the organization EEPA in Brussels and is chair of the Globalization, Accessibility, Innovation and Care Network. This is the first of a four-part series. This is the second week in a four-part series. Last week we heard from Professor Dr. Barend Mons, who gave us an introduction to the Virus Outbreak Data Network. And then next week, after today's webinar, next week we will have Albert Mons and Luis Bonino talk about one of the VODAN projects, which is Data Work in Action. And we have a really exciting webinar capping the end of the series, which has 3 different projects showing how mining all sorts of different data sets is helping in the fight against COVID-19. So with that, I'd like to turn it over to you, Mirjam, and again, just let me know as you'd like me to advance slides.
Thank you very much, Christina, and it's just really great that you are hosting this series, and I'm also really excited to see so many of our group from all over the world really today at this webinar. Thank you everybody for joining. And yes, we had already done quite a bit of work before this situation on COVID-19 started. In 2014, some of us were really involved in the situation in Liberia around the Ebola crisis, and one of the takeaways from that was that it was just really frustrating on how little preparedness there was, and also how much was put into resolving the crisis. And then when the crisis was declared over, everything kind of was taken away, and there was really no capacity remaining for any future epidemic. So we thought we really could do this differently. And so I've been working with the team of Barend and GoFair, and my concern has really always been, how can we make sure that especially countries with weaker perhaps health systems, and also not with a natural base around data science, how we can make sure that there is accessibility to this innovation. And so the Virus Outbreak Data Network, VODAN, or as we like to say sometimes, the Virus Outbreak Data Africa Network, is a response to that. But here today on the call, we also have some of my students from Kazakhstan, from Indonesia, from China. So this is really part of the international response. So then maybe if you go to the next slide, Christina. I wanted to talk today about what are the core objectives. What is it that we're trying to achieve? Why is the training of trainers so essential, so much the core of the establishment of a fair internet of data and services? And then finally, what are really some of the immediate next steps that can now be taken, and where we are really, I think, at this point now leading the innovation. So maybe if we start at the next slide on the objectives, looking at the objectives, and the next slide. Well, this is an article that was published this week on Monday, because we see that there is just such a phenomenal amount of resources going into a data science approach to COVID-19, and really a completely international approach, because we are here all dealing with the same epidemic. One of the developments that has happened in the European Union is that already the European Commission had declared that it was not really right for so much public funding to go into science without treating data, the results of it, as a public resource. So in Europe, from the perspective of science, we already have an acceptance that we do need a handling of data that is conscious of the value of those data and the need to be able to treat them as a valuable resource. But in the context of the COVID-19 approach, not all of these principles have actually yet been put in place. And part of that is also because it requires understanding. And maybe if we go to the next slide then, the very important key issues that we are trying to resolve through the Internet of Fair data and services is, first of all, that well, we are dealing with an incredible increasing amount of digital data in general, but also digital data related to health. We are also dealing with an incredibly fast growing increase of publications. If you just look at the publications on COVID, we are now within our group, one of our colleagues is analyzing 47,000 scholarly articles on COVID alone. So, you know, we just know that it's impossible to go through that amount of literature just by reading. So we really need to adapt our ways of looking at this. Then the other problem that we are trying to solve here is that the internet as we know it, it was actually really not designed in a purposeful way. And one of the results of that is that the internet is really very much an instrument for humans to share information, to find information. But from a machine perspective, the internet is a nightmare. So the question that we need to ask now that we are getting this vast amount of data is really how the machine can also help us to go through these data and to make sure that we are able to find quality data in this way that then can inform further development in tooling through AI and other tools. And for that, the solution that FAIR has put forward, actually since a Lawrence workshop was held in 2014 in our university at Leiden, is that there are really basically four essentials that we need to organize, and that is that data, first of all, have to be discoverable. We call that findable. They need to be accessible, but accessibility has to be organized within a context of understanding the sensitivity about these data, understanding that data are part of regulatory frameworks of sovereignties where these data are produced, but that there really is a possibility with those conditions to make data interoperable and make them reusable. And so this is really what constitutes the basis of the Internet of Fair data and services. And as it happens, from the 1st of January 2020, all science in Europe was conditioned to making the data that are collected within the context of science and produced in the context of science, that they are handled according to these FAIR principles and will be the basis of the Internet of Fair data and services. So these are the problems that we're trying to resolve. If we then go to the next slide, Christina, then you find here that the four principles have very specific tasks behind them, and we'll get to those tasks in the remainder of the presentation. We can go to the next slide. So here with this graph, we basically show the three essentials. We need to have an Internet of Fair data and services that can produce for society. We first of all need quality data. Secondly, we need computing instruments, and then we need tools. And so one of the very important elements of the Internet of Fair data and services is that we accept, and actually we take it as the principle, that data are managed and stewarded within their location of origin. And that means that it is a completely different way from the system where data are taken away, are then put in data warehouses and then analyzed. Here we're saying, no, the data that are stewarded within the location where they are produced, that is how we can assure that these data have quality, that we can find the provenance, the origin of these data, and that also allows us to investigate the data, putting them back within the specific context where they are produced. It also actually is a very good way of ensuring that we can find fake data, because data that really don't correspond with the data as we are finding them within the magnitude, the volume of data that will be available, can then easily be traced to their origin, and lacking origin will then further ensure that we can ask further questions to ensure those data and verify them. So the principle here really is to establish a connected internet based on the principle of data sovereignty, and recognizing that the data are handled and have to be handled within the legal context in which they are produced. And that is a good thing, because that also recognizes that data belong somehow to the organizations, to the administrations, to the place where these data are produced, and where they relate back to the data subjects. And so the task of the Internet of Fair Data and Services is really to make sure that this distributed resource of data connects under clearly defined conditions. That then means that it is the algorithms that will visit the data, and that is where also the governance around the algorithm and understanding the auditing, the basis for the algorithm becomes a very important task in the building of the Internet of Fair Data and Services. So if we go to the next slide then, Christina. Why is this virus outbreak data network such an important benefit for Africa? Also, I'd say many countries in Asia and elsewhere, is that really it avoids that digital data are removed to warehouses elsewhere. So the control and the ownership really remains within the place where they are produced and where they are stewarded. It therefore really ensures data ownership and handling. It also will really strengthen the health systems, because within the health systems, in all kinds of ways, within a hospital, within a Ministry of Health, within a medics department at the university, these data are a resource for analytics. And finally, it will strengthen the understanding and the capacity to deal with digital data as a resource. And this will strengthen the capacity for data stewardship, and also for producing tools that are relevant to a particular place and to particular questions that are relevant within each of the participants within the Internet of Fair Data and services. So then going to the next slide. This is now where the importance comes in of training. And really the training is in one way a, well, transfer of understanding, but really in essence it is building a community in which there is a common understanding of the purpose. And that is really a critical part of the whole project, because if we go to the next slide, the way in which we go forward is that the data are really handled within a way that makes sense to the particular situation, that makes sense to the particular context. So in our case, we have started our work with looking at establishing a fair data point in Uganda, which will serve Uganda, Ethiopia, Zimbabwe, and Nigeria in the next phase. We will also establish fair data points in those countries. And in fact, today I also heard that Tunisia will be joining our efforts. We have, in the next step, identified really that since capacity building and the organization of knowledge is such an important part of this, is that it's really important to establish training of trainers hubs and to include universities within those efforts as critical places where this training can take place and become really part of the curricula of data science, computer science, informatics, but also interdisciplinary serves the other disciplines. In step 3, very important step, recognizing that we are doing this in the context of incredible efforts at the moment by ministries of health, in the context of the fight against COVID, and that really this has to be something that contributes to those efforts and doesn't take the much needed capacities away. And also that within the leadership and the ministries of health, it's understood what we are trying to do here, and that this really gives and will continue to give ownership over data stewardship and data analytics to the administration as well. We also really have to involve and build trust with the hospitals and the clinics, especially if we include, and that is what we are doing, the data as they are produced within the hospital and the clinics. That's very trustworthy because these data are the closest to what has been recorded by the medics in terms of how they have treated the patients. But it also means that the hospitals and clinics really have to understand the purpose of what we are doing and are fully part of that. And I'm really happy to say that in the current setup, we have the highest levels of the hospitals in the countries involved, and they have involved both their clinicians, but also the people working on the data in the training of trainers. And so from there, having explained, we have to then also really concretize and lay down how we deal with those relationships, establish relationships that are accountable and that are trustworthy for everybody involved. If you go to the next slide. Part of the job has been to set up the information channels with the ministries of health, the bureaus of health, and really get an ongoing working relationship with every level. So we need a political level because the political level really needs to endorse what we do, but we also need to relate to all the levels where people are dealing with the COVID crisis, are dealing with the whole exercise of data stewardship and data analytics, and ask questions to them in terms of how they are best served, but also respond to concerns that they have. And so at the end of the day, it really serves us very well if we can have the endorsements as we have now of the private secretary, of the Minister of Health in Uganda, and also from the Bureau of Health from the region Tigray in Ethiopia. And that really empowers the community to go forward and to serve the fight against COVID-19. So going to the next slide. We then need, having had the endorsement, we then really need to understand the governance and the regulatory framework. And again, these might be different in each situation, and they will be different, and they should be different, because these are responding to a particular context. And so in our training, we have set up a document for research and questions where our trainers have now gone out to the hospitals and really determine what needs to be part of our understanding of the governance and regulatory framework. And again, part of this exercise is to include the ministries of health and the responsibilities that they hold. So maybe going to the next slide. So these are some of the questions. I think that the slides will be distributed, so you'll be able to see all of this. Going to the next. Here then we have set out the task for compiling the information flowcharts, and then if you go to the next slide, well, here you see, of course, kind of our classical repositories, which then are digitalized, but they are not digitalized in such a way that they would be machine readable. So part of the task is to make sure that we work with the documents as they are. In this context, we propose that we will work with the response form by the WHO for COVID, which actually interlinks quite well with other existing tools. We take the tool from the hospital or clinic as it is. We're not going to change it. We take the categories that are relevant for COVID, and then we the task is to produce a machine readable backend to it, RDF, that would allow the computer to find these data and to visit them, obviously, again, under the very stringent conditions that are in place for accessibility. So going to the next slide. And just by the way, this kind of process from pen and paper to digital to machine readable, that is something that needs to happen everywhere. We actually found that also in the context of Italy, a lot of the basic recording was done with pen and paper. So here, this is the different expertise that needs to be involved to establish a COVID-19 data community. So this is on the one hand, the establishment of the FAIR data point. This is really the officials in health administration who are responsible for governance and regulatory framework that need to be respected, the health professionals who need to understand the information flows and data handling and need to lead on that, and then the data scientists who create the semantic data modeling, and also the interdisciplinary data stewards who can really, from the different fields, engage with the ontologies that are within the data and that need to be understood and changed in such a way that they are ready for machine readability. And then in the subsequent phase, that is really where the tools can go over the existing internet to visit the data, always through the FAIR data point where the accessibility is arranged, and where we will be then looking at the machine learning, artificial intelligence and text mining tooling, where the auditing of the algorithms becomes very important, that these can be trusted, where we also need experts in legal knowledge to understand the regulatory embedding of the use of the FAIR data point, and of course clinicians and health analysts who are critical for the health data analytics. And finally, the experts, like in our case on COVID-19, we really need the experts in the field to formulate the hypothesis, but also once the data produce certain cardinal assertions, to really see how these can be tested and taken forward, so that we understand the meaning of the knowledge that is produced through data science, data analytics, and that this is properly tested and taken through the proper procedures before it can then be judged as implementable or advice for further implementation. So going to the next slide. Now the last part that I think is important to consider is where are we going from here? So we are now clear within the context of the training what needs to happen. What are some of the next steps that we are looking at still as part of the training? The training being essential to the realization of the Internet of Fair Data and services. So going to the next. Here you see you see here the FAIR principles. We have seen an earlier slide where these were set out, and these are color-coded in red and blue. So at the moment, the technical development team in Go FAIR is working on all the elements that are red. And that is the technical specification of what will constitute a FAIR data point. And so in parallel is the process that we are working on in the training of trainers, where we're really working with local authorities on the governance and regulations through which we can define accessibility and the domain